the Creighton Alliance has been amazing for us. The opportunities there are pretty spectacular. So we had a residency at Valleywise, and it had become very, very good. I mean, it's just amazing residency. St. Joseph's had a residency for a long time. And we knew a lot of the different attendings, the different leadership at each of the different programs, because we had worked with each other for so long. And we said, you know what, this is a perfect opportunity for us to bring everyone together, to have the largest number of experts in radiology here in Phoenix and Arizona to teach our residents, because we'd be combining all of those different experts in radiology. Not only that, we would have an opportunity to work with a public hospital, a private hospital, VA, Phoenix Children's. So there are multiple different healthcare environments that the residents could learn from, where there were no real areas where we didn't have a subspecialty of medicine covered in Phoenix. And so it was just, it came natural to us to bring everything together. There are, every healthcare systems has slightly different cultures, but as we've gone through the process, it's been an amazing kind of journey that we've taken down this path, and working with all the different residents in the different levels have been amazing. Truly have. I mean, the residents are some of the best that I've been around. They're hardworking. They're energetic, cliche, but they're the reason why I get up in the morning and go. The residents really keep the interaction, the fun, the energy for education, for research, and for helping with the healthcare of the community, and it brings it all together. So it's just kind of a perfect combination in my mind. That's part of the reason why I truly love working at Valleywise. There's always something interesting. There's something new. There's something on the horizon that we're doing. So I have the opportunity, and it's a true pleasure to be able to do it, to work with the residents, to work with the medical students, both Creighton and U of A typically, but we get medical students from all over the nation that want to rotate with us. So I get to teach all these different levels and have that opportunity. And in addition to that, obviously, one of the bigger components of what we love to do is providing the clinical care for our patients here within the community. And then on top of that, we get to work with strategic alignments. We get to look at the new healthcare system with Care Reimagined. We're spending large amounts of time, which is great, for making sure that we're planning. We're doing a very, very good job of putting together an amazing future healthcare system as we progress through Care Reimagined into the new hospital and some of the new healthcare systems. So working with residents with education, I get to meet and do some research. I get to do some I get to partake in kind of some administrative tasks, get to work with strategic. You can imagine, like, every day is a brand new experience. The most, I think, interesting interactions have been with patients that have medical imaging and are uncertain of what those results actually mean. And so we do love it when we can actually kind of answer some of those questions for those patients that are uncertain. So we had one patient, this would have been a few years back, that had a soft tissue hemangioma, which is a benign kind of cluster of vessels underneath the skin. And they thought that it was something that they were not going to be able to survive with. So I was able to sit down with them, show them the imaging, and say, hey, this is something that is benign. This won't grow. This won't go anywhere else. This is not going to, threaten, survival at all. You'll be fine. And it's those sorts of stories. And there are a lot of those stories where there's kind of a confusion as to what. There's a lot of medical terminology in radiology. There's a lot of specific nomenclature that can be a little challenging sometimes to decipher. So that was one story that we've had recently, but there are a multitude of stories where people come in. What does this mean? Is this terrible? Is this not bad? Am I going to survive? And I love being able to interact with the patients. And we've been working through the years with American College of Radiology, and trying to just, to distribute not only a medical, but also kind of a patient-centered report at the end to make sure that they're aware of what those findings mean. So we're working on generating kind of for lack of a better term, a lexicon, a specific set of terms to help make sure patients understand, kind of what the findings are in
Mhm.
their radiology studies.